article says Medicare Basics 3 presented by myself, Anthony Jason Fellow Jr. But in reality, it's myself and my team here tonight. I have my partner Maria Bissett. I have Roberta Cifelli. I have Michelle Mirabella, and I have Anthony Jason Fellow III back there. They're just part of the team. We had others, but they wanted to come here tonight to be part of this. I welcome you. Guys, you know, Medicare, as he just said, it's confusing. They inundate you with these commercials. They don't stop. We're here to take that burden off your shoulders if you haven't heard. So I'm gonna be a little interactive here. Who in the audience has Medicare? Everybody, come on, you gotta work with guys. I didn't get no hand. You don't have no Medicare. You're running solo. Put your hands. Come on, guys. Okay. Who has just original Medicare, standalone Medicare? Okay. Who has Medicare supplement, Medigap? Who has Medicare Advantage? Okay. And who has strictly Medicare with just a drug plan? So what you see here is everybody's a little different because some plans are good for some plans are good for others. Nobody's plan is the same. I try to teach my people when I'm talking to them. I heard they said somebody told me so. I heard they said somebody told me so. Guys, that's not the case. You have to do your research yourself. You have to find out what plan is specifically beneficial for you. Okay, so Maria, let's go to the next slide. One more question. When was the last time you had your Medicare plan reviewed? When was the last time you had your Medicare plan reviewed? Who's had a review within the past year? Good. Who's had a review maybe within the past 2 years? Okay. If you haven't, my father used to tell me this. My father used to tell me, shame on you, because you're only hurting yourself, not me. You got to get your Medicare plans reviewed, guys. They change every year. The numbers change every year. Everything changes in these plans. They start on October 15th because guess what? Right now, they're updating the plans. So you got to have your plans reviewed. What's good last year doesn't necessarily mean it's the best plan for you this year. You have to do the homework. You have to find out why spend unnecessary money. So let's go to the next slide. Okay. So guys, I'm going to read this real quick. I'm sorry. Okay. We want you to understand your options and opportunities. There are multiple plans, and the variety and continuous bombardment by advertisers can serve to cloud and confuse those trying to make the best choice for them and their families. I didn't like Jimmy J.J. Walker when he was on Good Times. I definitely don't like him on trying to sell Medicare. I used to like Joe Willie Namath when he was passing for the Jets. I didn't like him when he passed for the Rams, but I definitely don't want him to bother me with Medicare. And that's all these guys do. They're paid announcers to sell Medicare Advantage, like you said. You need a licensed, informed, reliable Medicare agent that acts as a resource, guys, for you and gives you the very best in service. We're going to make a promise right now. I know you guys don't know us, but we're going to make you a promise. This is our promise to you, not my promise, our promise. We are available to help and provide the very best advice possible. Nobody's wrong, nobody's right, but the plans change every year. What used to be good may not be good anymore. Not to be greedy, but you may be able to do better. Time changes everything except who you are. How do I know this? I know this personally. 1975. I went to go see a Pink Floyd concert at Roosevelt Stadium in Jersey City. The Wish You Were Here tour. It's amazing. In 1979, I was in the United States Air Force in England, and I went to go see an historic concert. I went to go see Led Zeppelin live in Never. 150,000 people, and we were rocking. Saturday night, Roberta and I, my wife for 35 years, went to the Borgata and saw a Tom Jones. Things changed. Things changed. And let me tell you guys, he can still sing. 82 years old, and he still got pipes and gold, as we said. But if you're within 3 months of turning 65 and you're eligible for Medicare in the initial election period, you can enroll in Medicare plan now. Deep down, you haven't changed, but you're preparing for a new chapter of life. Obviously, everybody's there already in this audience. This is just part of the presentation. So I'm going to hand this microphone off to Maria. She's going to take you through some of this, and then I'll come back at the end.
Thank you, Anthony, and good evening, everybody. Thank you for having us. So we're going to go through some education because, as you mentioned, it's very confusing. There's so many different parts. You see all these commercials. So what does it all really mean? So we're going to talk the basics today. And then if you have specifics, you can follow up with us after. So we're going to go through eligibility, what's Medicare, what are your options, high level costs, and then important dates. Bruce, next slide. Okay, so Medicare it's a government-run program, and it services 59 million people, and it's run by CMS, which is the Centers for Medicare and Medicaid Services. So they'll work in conjunction together. Next slide. So here's our different parts. We've got part A, B, C, D, and then your supplements. Your traditional Medicare is A and B. Then you have part C. That's your Medicare Advantage plan. So they're going to be separate underneath, they're not part of traditional Medicare. And then part D is your prescription drug coverage. Supplemental Medicare is also known as Medigap. So we're going to get into what all these different pieces mean and how they correlate to each other. All right, it's all right. Okay, so part A. Everyone might already know this in the room, but part A is going to be your hospitalization, and you can hit the next slide, and your skilled nursing. Okay, so part A is going to cover if you end up in the hospital, that's when your part A of traditional Medicare would kick in. Okay, and one more slide, it's also going to cover hospice and some home health services. Okay, next slide. So to recap, part A is your hospitalization, skilled nursing facility, and hospice and some home health care. So beneficiaries must meet certain requirements. Does anybody know what requirements you have to meet to get enrolled in part A? Or entitled? You have to work 40 quarters. So you or your spouse would have already paid into this from a payroll, right? Payroll deductions going into Medicare. So typically most people don't pay any premiums for your part A because you've been working throughout your life. So you become entitled, what they call it, you're entitled to it. All right, next. Now part B. So we had part A is hospital. Part B is going to be all your doctors, your preventative cares. Each year I go to the doctor, I get my preventative care, my blood work done. Some of it's injectable drugs that you can get right at the doctor's office, and then occupational and physical therapy. So this is all doctor's office related. That's when your part B kicks in. So part B will also help pay for covered services and supplies, but only when they're medically necessary. Most people here, probably in the room, you're probably paying it, are paying a part B premium. So everybody pays a part B premium unless you're low income. And the minimum amount as of 2022 that you would pay is $170.10. That's if you make less than $91,000 individually or less than $182,000 as a couple. And it goes up increasingly depending upon your income needs. And I think that the cap is at $578. So those are your ranges, but you're going to pay at least $170 per month. That's a per monthly fee. And typically it's deducted out of your Social Security. Next. So part A, hospital. Part B is our doctors. And now we have this part C, Medicare Advantage. This is where you're getting bombarded. So what is Medicare Advantage? So if anybody, when you were, working, if you had group health coverage, it's like how your group coverage would work when you were working, right? So it's HMOs or PPOs, private fee for service. So you're going to have a United, which is the AARP plan. You'll have a Cigna, any of the companies. So they're going to offer, just like they would offer group coverage to an employer. This is what Part C is. It's like a bundled service. That's Medicare Advantage. That's Part C. Next slide. So a lot of people will say, well, how does that differ? So Medicare Advantage is different than traditional Medicare. So what I want everyone to know is Medicare Advantage by law has to meet the same criteria and provide the same benefits as traditional Medicare. It's not offered from the government though. It's from a private health insurance companies like the ones I mentioned. So you may have different co-insurance or co-payments. Different regions offer different plans. So it does matter where you live, and they'll look through the plans to find out what's in your area. One of the biggest benefits that we've seen is it bundles in a lot of the plans, your vision, your dental, and your hearing. Okay, so it'll kind of bundle all of that into one plan, typically like you would have at work, when you were working and had the group coverage. Prior authorizations for certain services may be required, typically with your HMOs. And then in some of the drugs, they may require step therapy, go to the generic brand before you go, to the main brand. So with Part C, again, you can have your prescription drug, also the Part D, which is your drugs, that can all be bundled within a Medicare Advantage plan. So it's got to include all A and B, and then it has some of the additional services, and it can also include Part B, a Part D, which is your drugs. So again, everything that Medicare Part A and B covers, Part C has to cover. Some plans have the additional services, and then we've got Part D, which can be bundled into a Medicare Advantage, or you can have it as standalone if you're under original Medicare. So one thing I want to point out here on the screen, and you're going to see it. If you decide not to join the Medicare prescription drug plan or a Medicare Advantage plan with the prescription drug piece on it when you're first eligible, and you don't have credible coverage, meaning you're not still working with an employer that's covering that for you, and you decide to enroll later, you would get assessed with a late penalty fee, and that takes place forever.
Hi, sorry to interrupt. The slides on Zoom is not updating. We're still on the first slide.
Oh, thank you for letting us know. Should I keep rolling or? Okay, all right. So what is the supplement? So I know some people had supplemental plans in here, or the Medigap plans. These can only be purchased with traditional Medicare, not with Medicare Advantage. Why? And you think about the name. It's a supplement. It's a supplement to original Medicare. So what it does is it helps cover some or part of your out-of-pocket costs related to Part B. So it will cover A and parts of B. So if you have original Medicare, a Medigap plan or a supplemental Medicare will provide additional coverage, and you'll have to pay a monthly premium for that as well. And the best time to purchase that is during your initial enrollment period. So if we think about this in a broad-based terms, they break it down into 4 options. So your option 1 is original Medicare. You've got Part A and you've got Part B. We've got our hospital coverage and our doctor. Okay, so that's just government. That's what we have. Our option 2 is we've got original Medicare. Okay, we're paying the Part B premium, most of us not a Part A, and then we can add on a supplement to help with some of our deductibles and coinsurance. We're going to pay a premium for that plan, and then another drug plan as well. And there's a premium for that as well. Our third option is a Medicare Advantage plan. So most of these have premiums, some don't, but this is going to wrap in and bundle Part A, Part B. You can do D as well, plus some other extra benefits and services like wellness programs. You can get gym memberships, things along those lines. And then option 4 is just doing original Medicare without the supplement, but you're going to put that drug plan on because you don't want to get hit with any late penalties. So those are kind of your 4 broad-based options if we're breaking it down in buckets. So some things we need to keep in mind regarding the supplements. So beneficiaries that have enrolled in a Medicare Advantage plan for a year may not qualify for a Medigap coverage if you're joining back to traditional Medicare. So there's some nuances and things that we need to be aware of. The Medigap policies have to follow your federal and state laws. One of the biggest changes we have is starting January 1 of 2020, Medigap plans will not cover the Part B deductible. So there's always a deductible in Part B, and they're not going to cover it anymore after 2020. Plans C and F, if anybody knows, is known to be the best Medigap plan, of the Medigap assortment out there. You'll be grandfathered into that if you were already on it, and those eligible for Medicare before January 1, but not yet enrolled, could still purchase a CRF. But nobody else can. So new enrollees after 1/1 of 2020 will no longer have that option for Medigap Plan C or F. They are phasing them out. Okay, next slide. So you'll have this information. You can look up, what the different policies are, what they look like. There's also a link to the state health insurance program. It's an assistance program. You can reach directly out to the state if you need assistance with either your Medigap, or if there's, having trouble paying premiums or drug costs, you can always reach out to the state to see what programs are available. Next slide.
We can't see the slides advancing. Now we can.
Now you can. All right. So not only are there different parts of Medicare that are confusing, there's a whole bunch of different enrollment periods, and then they love to put acronyms with it just to make it really confusing for us. So you have your initial enrollment, there's open enrollment, there's an annual enrollment, you've got your Medigap enrollment, Part D when you initially sign up. And the biggest thing that we're all going to take away, thankfully, most of you are already enrolled, but late enrollees may incur a penalty for not signing up for Part A, Part B, and D when you're first eligible. So if you've been working your whole life and you could be over age 65, but if you still have credible coverage with your employer, you're not late yet. It just depends on when you drop that credible coverage. But if you've turned 65 and you haven't done anything yet, there's a good probability that you're going to incur some late penalties. So for your initial enrollment, you've got a seventh month period. So it's 3 months before your birthday, your birthday month, and the 3 months after. So you've got 7 months to make a decision to sign up for traditional Medicare or Medicare Advantage. The Medicare Open Enrollment, and this is your annual, it's called AEP. That's what's happening and why you're getting bombarded with all the commercials and everything on the radio. That's October 15th through December 7th every single year. You have the ability to join, switch, or drop a Medicare Advantage plan. So that's what's coming up right now, and that's why you're getting and seeing all of that. If you're already receiving Social Security or Railroad Retirement Board benefits, you're automatically enrolled in Medicare on the first month of that you turn 65. Medicare Supplement and the Medigap policies, you have a 6-month open enrollment period once you turn 65 and have the qualifying event and sign up for Medicare. And then Part D is you need to sign up within 3 months of receiving Part A or Part B, or again, they're going to mention that late penalty again for the rest of the time you're alive paying premiums. Yeah, yeah, they have late penalties because once everybody turns 65, because it's the government run program, they want everyone to enroll when first eligible. Then you have your open enrollment, if just Medicare Advantage. So you have that open, you have your annual enrollment, and then come the new year, you have between January and March. If you're already in a Medicare Advantage plan, you can switch to another one. You can be, this isn't working for me, and you can switch to another one. You can also return to traditional Medicare. However, if you re-enroll in traditional Medicare, you may not be able to get a Medigap policy at that time. It just depends on your situation. Traditional Medicare beneficiaries cannot switch plans at this time. Next slide. All right, so we're going to go through a table that kind of goes through the differences, because I think the biggest confusion is traditional Medicare versus Medicare Advantage. So Bruce, if you could advance us one slide. All right, so here we've got traditional Medicare on one side. It's kind of hard to see, and Medicare Advantage on the other one. So traditional Medicare, you can go to any doctor in the US that accepts Medicare, right? So as long as they accept Medicare, you can go there. In your Medicare Advantage plans, you're going to be limited to the network. Just like when you were working, you had your group coverage. You're going to be limited to the network, and you may need to choose a primary care provider. This kind of acts more like a managed care network. So all your doctors and the labs and stuff will all kind of talk to each other. The results will all be, shared. When you're looking at traditional Medicare, you can see specialists with no referrals. In Medicare Advantage, you may need to. So I want to stress the word may. It all depends on the plan. That's why it's always good to look and review. It's not always required, but it may be required. And then authorizations are not needed before you seek services. And then prior authorizations, again, may be required. You may have to have some step therapy with the drugs. It just depends on the plan. Typically, HMOs are going to be the ones that require that, not your PPOs. Next slide. So in traditional Medicare, you can purchase the supplemental policy, which is the Medigap, to help cover some of the cost sharing in original Medicare. In Medicare Advantage, you can't do that. Medicare Advantage is bundled over here, and then you've got traditional with the supplements over on this side. They're accepted nearly everywhere. In Medicare Advantage, it depends on your region. Includes injectable infused drugs. The Medicare Advantage may include all-in-one coverage for all of the drug prescriptions. So if you've got that Part D, then everything's included all in one. Here on traditional, your eye exams and treatments only related to an injury or illness are included. but not routine eye exams. We're in a Medicare Advantage plan. You can get vision care, dental, and hearing all bundled and wrapped into one. So again, traditional Medicare, you don't pay a Part A premium, standard Part B premium, depending upon income. With Medicare Advantage, the premium's going to vary. Everyone is different. You've got the 20% co-insurance in Part B. For Medicare Advantage, they can charge you or may require up to 20%, but they don't have to. So they can't go higher than the 20 because that's what traditional Medicare has. They can go up to 20 until you're yearly out of pocket, which I'm going to stress again in a minute. Your Medigap Medicare may help cover co-insurance. Again, Medigap is not allowed to be purchased with a Medicare Advantage. And the biggest takeaway that I want everyone to be aware is if you're only on original Medicare, you've got no out-of-pocket limit. So if you just have Parts A and B, there's no out-of-pocket. There's no maximum. There's no stopgap. If you end up in the hospital for a really long time, you're going to get a really, really, really big bill. There's no stopgap. We're in a Medicare Advantage plan. Just like kind of group plans are, you've got a max out of pocket. So once you hit that max out of pocket, the plan's going to jump in and pay for everything. So there's a stopgap here that you don't have with just original Medicare. Next slide. That's what happens with touchscreens. You never know what's going to pop up next. So that's why, high level cost wise, we can't, besides the Part B premiums, I can give you definites about the 170 and then it going up to 578, but depending upon your income, but everything else is really unique to you. And that's why it's always good to review it. So if you go to the next slide here, one other thing that we want to point out is there are special needs plans. So, they're more focused in specialized healthcare, and there's drug lists that will be designed to meet these criteria. So this is if you have chronic conditions, you have diabetes or a heart condition, there are plans out there that are specifically made for you. There's also Medicaid assistance from the state if you're in special needs, as well as if you are in nursing home institution types, there are other plans out there that will help pay for more of the coverage for you. So they are out there, and they include all parts of Medicare A, B, and D. All right, so this is kind of, and I'm going to bring Ant back up in a minute. This is the takeaway. If you haven't reviewed, what we would ask everybody to do is get a list of your doctors that you must have, get a list of the prescription drugs that you have to take, and we can run it through the system again. And also let us know, are you traveling out of the country? Do you like to travel? Where do you like to go? Because we can run through and find plans that could provide you more services and potentially be cheaper for you. But you may be in the best plan, but you won't know until you actually sit down and kind of review and get all the information together to find out what's best for you. So if we look at next slide, there's going to be resources in here. The Medicare and You handbook comes out every single year. If you want to, it's kind of boring, but you can fall asleep to it at night, but it's got a lot of great information out there. Just the basics of Medicare and a lot of the information that you see here, that's what's going to break it all out for you. And here's all the important websites for it. And we've got one more page of resources, Bruce. So everyone will be able to have these at the end of this. Here's more here. And the next slide is we just want to, number one, thank you for your time. I'm going to bring Ann up here. There's a lot as part of Medicare. And as he mentioned, it's always good instead of calling an 800 number to have local people that you can call and ask questions and talk to.
Yeah, thank you very much, Maria. So Maria and I work together every day. We all do. All of us work together every day. Our website is right there. ThinkSmartMedicare.com. ThinkSmartMedicare.com. All of you have a form in there, permission to contact. Everybody in here should be filling out that form. So if you fill out that form and we have a meeting with you, what do you think the cost of that meeting is? Zero. After there's no cost. It costs you nothing for us to help you. Absolutely nothing. There's no cost, no internal fees, no hidden fees. But guys, especially some of the people that raised their hand and said they only have Medicare with no out-of-pocket limits. Guys, you gotta change that now. You got to go and look at your opportunities now. That's really unacceptable. The risk that you're taking. I told my son Anthony, I know a guy who got ruined. He got put in the hospital. He didn't have the correct coverage, and they took everything he had. I know him personally. He's never been the same since. So with that, you do have to take this opportunity if you want to have us review it for you. Again, what we're going to need your doctors, we're going to need your medication. 1, 2, 3. We'll put it through the computer. We'll run the best plan for you. I heard they said somebody told me so. Even if it's your spouse, that doesn't make it right. Do your due diligence. Allow us to run the numbers for you. Let's see where you stand. Let's see if you are in the best plan. Sometimes change is hard, but sometimes change is good. If you're not in the best plan, why should you keep on paying money or not getting the benefits you deserve when it's right in front of your face? It's right here. You don't have to do anything special. Maria, am I forgetting anything? Guys, I want to take, on behalf of Maria, myself, and my team, thanks for taking the time to listen to us today. We're trying to take the Jimmy JJs and the Joe Namaths out of your life and just be the people that you see in front of you. We are local. I am a dear, dear friend of Mr. Blum. There you are, buddy. Anytime you need us, we're here for you. If you fill out those forms and you want to have a meeting with us, guess what? We're coming back up here to have a meeting with you. So thank you. Everybody, take care going home tonight, even though going home is not too far for you guys. You have a remarkable community here. God bless you with that. And once again, thanks on behalf of my team. Have a great night, guys. I'll repeat it. So the lady had a question about the restrictions on Medicare Advantage. So can there be restrictions? Yes. If you notice what Maria said when she was talking about it, maybe there may. Not all plans are the same. There's many different Medicare Advantage plans. If you don't need to worry about being out of state or out of country, then no, this plan may work for you. But if you do, then we have to find a plan that doesn't have those restrictions. So there are plans that don't have those restrictions. For me, I'm in New Jersey 99% of the time. I wouldn't need a plan like that. But for you, if you travel, if you travel abroad, if you travel to other states. So specialized care, once again, HMO, PPO. HMOs, some of them do require referrals for specialized care. Remember the old PPOs when we were working. For PPOs, you really don't need that referral. You go more or less to anybody you want to go to. So HMOs Medicare Advantage plans have HMOs, but they also have PPOs. Okay, so with PPO, anywhere you want to go. Yes. Correct. Correct. So with that, the same lady asked about going into Medicare Advantage and then deciding you don't want to be there and you want to go back to a Medicare plan with a Medigap coverage. Can you do that? Yes, within 1 year. So you have a 1 year window. If you change to Medicare Advantage because you like the price is better, or you're getting more benefits like hearing, like vision, like dental. You could look into that and join a Medicare Advantage plan. Within the first year, if you don't like it, you can switch back. Right, but after that, no. After the first year, you cannot switch back. You're welcome. Yes. They change every year, Bruce. That's just the answer. So Bruce asked me, I'm sorry, I'm not used. So Bruce asked me about Medicare Part D. You want to take it for you?
Go ahead, finish.
So Bruce was asking me about Medicare Part D and the donut holes and prescription drugs. And what was the question? Okay.
So typically overall, each plan has their different formularies with what drugs they cover and things like that. But you always have your, co-insurance deductibles. And then what will happen is there's an initial coverage, right? So you've been paying your deductibles that hit a limit, and then it'll fall into that donut hole, that coverage hole that it is. And then after that, even some of the expenses that are covered through there, even if the insurance company is paying it, will count towards all of that. And then it goes into, once it hits catastrophic coverage, then the plan will kick in and pay certain things. But there's if we sit down one-on-one, we can go through and show you the different, it's like the initial, then there's the donut hole. And that's for people probably that are on a lot of different prescriptions and medications, and ones that, could be expensive if they're not covered under the plan. But those are things that we can address and go through specifically for each plan.
Anybody else? Yes, sir. Yeah, we would have to look on your plan. I'm sure they're in some plans, not all plans, but nobody's in all plans. I would say it would have to be for Sloan Kettering. I would have to look into that further. I don't have that answer today. Sorry. So I have, and what's your name? Jim said hospitals for special surgery does take Medicare. He had surgery there this year. Like I said, I thought there was certain plans that did take it. I just wasn't sure. I don't want to give you information that wasn't. Sloan Kettering, I'm not sure. Thank you.